You usually see the race as like what Komen is, but Komen's so much more than just the race.
Komen Tulsa is breast health educators, advocates, investors, and problem solvers. Komen Tulsa empowers women by providing educational materials, a website with breast health information, and a directory for services that help women find resources for mammograms, breast cancer diagnosis, and the journey to survivorship.
I think that the real effectiveness of this program is based upon Komen's efforts to educate, not only the patient population and the community population, but the business and the corporate population.
I was 25, so I imagined that, they were going to tell me this was nothing. And even when they told me they were worried about it, I still didn't believe it. There's a fear of what's about to happen.
Komen Tulsa also provides support for women facing a breast cancer diagnosis and a community for survivors to share, encourage, and celebrate together with the Race for the Cure, the Survivor Program, and the Pink Rose Survivor Luncheon.
I was looking for a purpose. I didn't know why I had been given this challenge, and I wanted to find what my purpose was for this. And Komen gave that to me. Komen helped me to reach out to other survivors, and they helped me to get a sense of community with people who've gone through the same things I have, someone I could talk to who's experienced everything that I have.
75% of the net proceeds raised by Komen Tulsa stays in our community to fund local breast cancer screening and education programs. Since 1997, more than $4.7 million has gone toward breast health services for low-income women. Morton Comprehensive Health Services, Indian Healthcare Resource Center of Tulsa, and Oklahoma Project Woman are current recipients.
About 50% of our overall patient population is uninsured, and that continues to grow. This is like the perfect partnership. Uninsured women in need can come in and get free screening, free testing, and then a forward referral if something is wrong for follow-up care for a significant problem. It's a continuum, which is very rare for the uninsured in terms of healthcare delivery today.
The remaining 25% of money raised by Komen Tulsa goes to support the Susan G. Komen for the Cure Award and Research Grant Program, which funds cutting-edge breast cancer research. $1.7 million has been invested since 1997.
Over the last few years, the treatment for breast cancer has advanced tremendously, and we're changing a lot of the ways we treat different breast cancers. We're realizing it's not one disease, but probably many diseases. I think the field of genetics is where the breakthroughs are going to come from. I think it is still considered a new field. It's technology-driven, it's data-driven. I'm excited for what the future holds.
When Susan G. Komen for the Cure was founded in 1982, the 5-year survival rate when breast cancer is detected early was 74%. Today, it's 99%. There are 2.9 million breast cancer survivors in the U.S., more than any other group of cancer survivors. But even though breast cancer deaths have decreased 34% since 1990, 40,000 women a year still die from breast cancer, here in the richest country on earth. In Tulsa County, more women are diagnosed and more women die of breast cancer than in any other parts of the state and the nation. African American women in Tulsa County have double the rate of late-stage breast cancer diagnosis, more than all other races. And compared to state and national averages, African American women in Tulsa County have a 10% higher breast cancer death rate.
What I've been absolutely appalled by since I've been in Tulsa is that we have an awful lot of patients that may have, using breast cancer as an issue, they may have a lump in their breast, but they don't think to go to get a test or get a screening or to get anybody to take a look at it simply because it costs too much money.
Clearly, there is a need in our community to focus on minority women by reaching out with education, services, and support.
Bottom line benefit for the Komen program for our patients is that it allows early detection and education for a horrible disease. And it allows that early detection without any attached financial requirements.
And the benefit to our community as a whole.
Is a healthier community, reduced costs for hospitalization and major medical expenses for the uninsured, better families.
Tulsa Komen is dedicated to meeting that need, but we can't do it without your help.
Morton can't underwrite the cost of these tests.
Komen does tremendous things for women with breast cancer and spread the word, and they contribute to research that goes on across the country. And the research money that Komen can help raise is going to aid in all of this.
You can see how it's helping women, and you can see just all the smiles it brings, like on the race. You see, it's such an amazing experience to be able to see all those women and how happy they are, and just that sense of community. And without donations, we can't do everything that we do.
Join us as we continue to take care of women in Eastern Oklahoma and fight for the cure.
Komen's very important just to give women a sense that there's someone out there to help them.